All right. Well, good morning or afternoon, wherever you're coming from. It's just turned afternoon here on the East Coast. Brandon Garrett, the National Minority Quality Forum, with today's webinar on diabetes and vaccines that will be led by our very own Kristen Hobbs. Before I turn it over to Kristen, I just wanted to make a quick announcement that every year, at least since 2016, the National Minority Quality Forum has hosted or selected 40 individuals to be in our 40 under 40 top leaders in minority health. And those applications are out now. At least you can go on our website, and I'll put a link into the chat box for it. So if you or you know someone that's interested, please share. We'd love to get a good quality group of folks on there. And at our National Annual Summit, I believe it's our 21st coming up April 17th and 18th in 2023 in Washington, D.C. And without further ado, I will take to one of our very own 40 under 40, Kristen. So, Ms. Hobbs?
Hi, Brandon. Thank you guys so much for joining us for our Champions for Total Health webinar on diabetes and vaccines. I am Kristen Hobbs. I'm the Director of Quality Improvement and Equity, as well as the co-chair of our Cancer Stage Shifting Initiative here at NMQF, and excited to be leading our webinar today. So just a little bit about our Champions for Total Health series. We really wanted to make sure we could expand our focus in 2022 to reach historically excluded communities where they are in the context of dealing with and managing their chronic illnesses at the intersections of vaccinations. And so that's what has brought us here today for diabetes and vaccines. It is National Diabetes Awareness Month. And we will be talking a lot about that intersection in minoritized communities. We also have a drive flu program that we implement, a rapid cycle plan, do study, act, quality improvement framework that does seek to improve flu vaccinations in these historically excluded communities. So without further ado, let's get started. We have a lot to talk about today with our esteemed panelists. The first being Dr. Jasmine Gonzalvo. She is the Chris and Theresa Dimos Director of the Center for Health Equity and Innovation and Clinical Professor at Purdue University and Eskenazi Health. Welcome, Jasmine.
Thank you, Kristen, and good afternoon or morning to everybody, depending on where you're at. I gotta, well, of course, now I gotta pull up my slides and share my screen. Okay. Oh, are you all seeing it in presentation mode? Hopefully, yes.
Yes, we are. Thank you.
Great. Thanks, Kristen. Okay. Well, one of the things we wanted to start off today when we were planning for this webinar was just talking about the relationship between diabetes and COVID-19 or influenza. So I won't go too deep in the weeds with this, but just give a broad overview of what's going on between diabetes and COVID-19, really. Early on, what we're seeing here and what's on the slide is essentially describing the relationship and really the prevalence here. And so what we know is that COVID-19, the impact that we saw on hyperglycemia, we saw a higher incidence of DKA and even new onset diabetes. So we know that the hyperglycemia and COVID outcomes and that association were people with diabetes had worse outcomes at hospital on admission while hospitalized. We knew the mortality associated with DKA and people with diabetes and COVID is also worse. And then what came out after the pandemic had gone on for a while was seeing higher cases of new onset diabetes. So that was something that was sort of a nuance coming out with the impact of COVID. And the impact or the relationship is bidirectional. So not only is it potentially that COVID can cause new onset or exacerbate new onset hyperglycemia and cause new onset diabetes, but the direction, it being bidirectional as well. So when we see obviously poor outcomes in diabetes and that being a risk factor for developing severe COVID-19 outcomes as well. So hypoglycemia, associated comorbidities, related complications, and in the context of especially social determinants of health, we see worsened outcomes. And then again, the hyperinflammation associated with severe COVID-19, hyperglycemia in that setting, as well as some potential direct effects of COVID-19 on the pancreatic beta cells is also a relationship that we've established as well. So knowing that we were seeing worsened mortality, worsened outcomes with this sort of bidirectional relationship with hospitalizations and whatnot, this is really just showing that all of these are contributing to poor outcomes. And so we know that there are existing disparities because of a lot of socioeconomic factors, but then when you layer on diabetes and the complications, we're really seeing poor outcomes associated with COVID. And the importance of this talk today, especially, is highlighting the importance of vaccinations and improving access to vaccinations to really help with this problem and this issue that I'm describing here, that if we can get the word out and improve access for people and populations with diabetes and sort of be proactive about preventing complications that may arise from severe COVID or influenza illness through vaccinations and improving those vaccination rates, then we're really doing something impactful to help prevent the poor outcomes. What we see here, and this is getting sort of into the nitty gritty of how COVID actually infiltrates beta cells and can cause direct injury to the cells, which can lead to diabetes or hyperglycemia or new onset diabetes. And that's displayed on this slide here, looking specifically at the angiotensin converting enzyme 2 receptors on cells, and really leading to that direct injury to cells that can contribute and exacerbate hyperglycemia and lead to new onset diabetes. This is just the actual mechanism of action that we see that explains that relationship here. So we are seeing the initial trend, which then led to really making the claim here that individuals under 18 years of age with COVID-19 are more likely to receive a new diabetes diagnosis over 30 days after infection than were those without COVID-19 and those with pre-pandemic acute respiratory infections. So that relationship is fairly well established at this point. And so knowing that COVID-19 really does have an association with new onset diabetes, and again, sort of that bidirectional relationship being problematic as well. When it comes to influenza and diabetes, there is some literature to describe some new onset diabetes and some injury to the beta cells or the pancreas, actually, and the association with influenza, but not as well established as what we know actually about COVID. And so again, there is some literature to suggest that relationship exists, but again, not quite as strong as the relationship with COVID. We do know that outcomes in people with diabetes for influenza and severe influenza, so 3 times more likely to die with influenza or pneumonia and 6 times more likely to be hospitalized. So we know that relationship exists, that people with diabetes do suffer from worsened outcomes with influenza. So I kind of gave a little bit of a hat tip to this earlier, but really emphasizing and improving access in populations that are under-resourced is a critical area of need and of work. When you layer on potential barriers related to the social determinants of health, we really can see disparate outcomes and increased mortality, particularly when we have those other barriers to combat. My work at the Center for Health Equity and Innovation, I just want to show one example of a model here very quickly before we move on to the rest of the presentation. Through Purdue and my center, we partnered with Walgreens, and we really look at things through a pharmacy lens, actually. So here we have a bunch of pharmacy and public health students that help out at these health access events. But what we've been able to accomplish is partnering with food banks and homeless shelters to improve access for communities who hadn't been accessing vaccines, both flu and COVID vaccines for whatever reason. We were finding that a lot of the vaccines that we were administering were actually first-time vaccinations. And a lot of our population here, again, have a lot of barriers related to the social determinants of health that may have prevented accessing the vaccines independently. So being on site at food banks and homeless shelters, we have had some success and some momentum to continue offering those events. Through the course of June 2021 through October 2022, over 21,000 families have been served at the food pantry events in terms of just interactions with those clientele. And we've been able to administer close to 2,000 vaccinations. Actually, today we would have surpassed 2,000 vaccinations at one of our events, and we're looking at vaccine hesitancy and having those conversation, and then also looking at a pretty diverse population, or serving people of color through these vaccination events as well. So this is just one model that I wanted to highlight here in terms of improving access to populations who were not independently accessing the vaccination, or who had barriers to accessing the vaccination on their own. So happy to answer more questions about this model towards the end, but with that, I will stop sharing and kick it back to Kristen to introduce our next speaker.
Awesome. Thank you so much, Dr. Gonzalvo. The work you're doing at Checky is absolutely fantastic. So just a quick reminder, you can engage in all kinds of respectful and networking communications in the chat, but please put your questions in the Q&A box so that we can see them. We have some pre-submitted questions, and then we'll get to your live submitted questions during the Q&A portion. So I would like to introduce Dr. Michelle Fiscus, who is the Chief Medical Officer at the Association of Immunization Managers.
All right, thanks, Kristen. Seeing my slides okay?
Yes, they are perfect.
Perfect. All right. Well, good afternoon, everyone. So I just wanted to give you some updates on what flu is actually looking like right now, and some of our concerns about where we are in the season with flu vaccination rates across the US. So this is a really ugly map of what flu is looking like right now. And I actually don't recall a year where we had to get a new color, that purple color, because flu activity was so high. So you can see that in the southeastern United States, especially, they're just getting hammered by influenza. But really the whole lower 2/3 of the country is seeing really high rates of influenza. And that's concerning because this season is not only severe, but it's also really early. And a lot of folks wait until they get into November to get flu vaccines. And really, you know, here we are mid-November, well on our way into this year's epidemic. This is a chart of the other seasons, all of these other seasons here. By year, the teal one is 27-18, which is always thought to have been the worst season over the last 10 years or so for influenza-like illnesses. So this is respiratory illnesses visits, outpatient visits for respiratory illnesses. So not just influenza, but also RSV and enterovirus and common colds and others that required visits. But you can see where this red arrow is, that this is this season. And so again, early compared to what we've seen in previous years, and that trajectory of that red line is one that's really concerning for a terrible season that may outpace what we saw in 2018. Just by comparison, you can see the red line towards the bottom is 2021, and the orange one is 2020, 2021 is the red one. 2021, 2022 is the orange one, where we saw relatively light flu seasons. This is not going to be one of those seasons. And then this is looking at the hospitalizations specifically due to influenza. So these are people who've been tested and shown to be hospitalized because of influenza. And again, this red curve out to the left is where we are now, a very early season trajectory that we really don't like, looking at these hospitalizations so far for flu. And then to the right, this is a comparison of the characteristics of these hospitalizations. So about 40% of these have been people with metabolic disease, which can include diabetes, compared to about 6% that are people who have no underlying health conditions. So just as Dr. Gonzalvo mentioned, with people with diabetes having about 6 times the risk of hospitalization of people who don't have diabetes, we're seeing this play out in real time with this year's hospitalizations, because we're just a little over 6 times as likely for one of the people hospitalized in this season to have diabetes or another metabolic disease compared to previously healthy individuals. This is a slide from CDC just looking at higher risk for hospitalization based on ethnic and racial groups as well. And you can see that Blacks across the board have had higher risk of hospitalizations actually until this last season where that risk came down some, which is wonderful. And then American Indian, Alaskan Natives also having very high rates, and Hispanics having higher rates than whites generally. So we do want to make sure that we've got people protected as best we can. When we look at deaths, the graph on the left, this is the mortality rate. This is kind of a busy graph, but this red line that's bouncing up and down, these are deaths from any respiratory illness. So this could be flu, it could be RSV, it could be enterovirus, it could be COVID. And so we're over here now in this end part of 2022, and this blue graph are the COVID related deaths. So you can see as we were going through, almost all of the respiratory deaths were COVID related over the last couple of years. But right now we've got this big gap between what we're seeing with COVID related deaths and what we're seeing with other respiratory deaths. And so, a lot of these are going to end up being influenza or some other respiratory disease. And then over here to the right side, these are pediatric deaths that we've seen. And I'll just point out that in 2021, we had only 1 death in the entire nation during the 2020-2021 influenza season for children. Then that picked back up again last year to 44. We're now at 7, and season didn't begin until the beginning of October. So we've had 7 pediatric deaths just in about 5 weeks of this season so far, so that does not bode well for our kids. Almost always children who die from influenza are unvaccinated, so it's really important to get them vaccinated. And we've had 2 deaths this week and 2 deaths last week. So of those 7, 4 of them have happened just in the last 2 weeks. And then if we look at the number of flu vaccinations that have been given, so this is for adults so far, and this is comparing doses that have been given in pharmacies and doses that have been given in physician medical offices. And you can see, generally a lot of people, that's these top green and blue lines, get flu vaccines in pharmacies when it comes to adults. And this year's pharmacy line is this top red arrows pointing to this purple line. And so they're pretty much right on track in pharmacies with what happened last season as far as giving flu vaccines. But what we're seeing is that medical offices, which is this lower red chart and dot here, are down significantly from what we've seen in past seasons. And so this trajectory is really worrisome, whether this is because we've got physicians' offices that don't have the capacity to vaccinate people, or we've got people who are not getting vaccines when they're in medical offices, or we have providers that just aren't recommending vaccines. And we know that when medical providers make a strong recommendation for flu vaccines, that people are much more likely to get them. So thankfully the pharmacies are staying on track here, but we may have a lot of missed opportunities in medical offices as vaccines aren't being given there as much. This is what it looks like for pregnant people, and this is year over year. So this year is the orange bar, this 2022-2023 season. And you can see across the board, when we look at race and ethnicity, we've got rates of vaccination amongst pregnant people that are down this year compared to years past. They're actually the lowest they've been for this time in the year than we have seen in any of the last 3 years. So, just again, making sure that we're messaging to pregnant people the importance of getting vaccinated, because they are at higher risk for hospitalization and death from influenza as well as COVID. Sometimes pregnant people have gestational diabetes that can put them at even greater risk. And we want to make sure that they're getting flu vaccines to help protect their infant when they're born, because they're not able to get their infant immunized until they're 6 months old. And so we want to try to protect those babies too. So when moms get vaccinated, they pass those antibodies to the baby, and that helps to protect that baby. And speaking of babies, this is where we are with kids. So last week, this red line was falling off. This is this season here, 2022-2023. And we did see a nice uptick this week in getting vaccination rates that are more on par with last season, at least. This may be in part due to all of the media around the RSV hospitalizations that we're seeing in children. We don't have vaccines for children for RSV, but we do have vaccines for influenza and COVID that can help keep them out of the hospital. So that may be in part what's driving this. And we actually see this uptick in minority groups, which is wonderful. So the green bar, I don't know why they didn't use the same colors as they did last one, but it's the green bar we're looking at now for 2022-2023. And you can see that we're on par overall with last season for children getting vaccinated. But look at the Black and Hispanic rates. They are well above last season, sometimes above the last 4 seasons. So again, it might be parents that are concerned about all these respiratory diseases that we're seeing in kids. And it's actually the non-Hispanics and non-Hispanic whites that are trailing behind. And that may be in part due to some of this ideologic adoption of more anti-vaccine or lack of vaccine confidence that is sometimes now tied to political ideology, unfortunately. So that's one bright spot. The other bright spot is that, we hear every year about the flu vaccine match, and some people think, well, it's not worth getting flu vaccines because, they never pick it right and they don't stop flu. So this is a pretty busy table on the right, but basically what it shows is that the vaccine virus and the viruses that are circulating are very, very similar. So their antigens are north of 90% similar. The proteins that we're seeing on those viruses are very similar to what the viruses were that were picked for the vaccine. So this should be a good match season. We'll get some mid-season efficacy data in a few more weeks, but at least early indicators suggest that this vaccine is going to do a good job. What we're seeing circulating right now, and these are last week's numbers, this has shifted just a little bit. H3N2, which is one of the type A viruses, we're seeing at about 75% of what's going around. H1N1 is about 25%, and there's a little speck of influenza B that we usually don't see very much influenza B this time of year. It's usually a little bit later in the season, but the last couple of years, we've not really seen any influenza B to speak of. So there's a little bit out there right now, this Victoria lineage of influenza B. All of these strains are covered in the flu vaccine that we have, and it looks to be a good match. So encourage people to get that vaccine. So what can we do? So one thing you can do is follow the CDC's weekly flu reports. That's where all of those graphics that I showed you early in the presentation, I have snagged from the flu view, and keep track of what's going on in your community, whether or not you're seeing higher rates, what your hospitalizations look like. CDC has a lot of social media resources that you can use to encourage other people to get vaccinated, including this Help Them Fight Flu, so they can do what they do, platform that they're using right now, targeting children and adolescents primarily. Stories always make a big impact, and Families Fighting Flu has a whole library of video vignettes about children and adults who have either died from influenza or have faced very serious illness from influenza. And so sometimes sharing those or watching some of those and being able to retell those stories to people who might be lacking some confidence in influenza vaccine can help move them towards getting vaccinated. And then there are also resources like getmyflushot.org, where this reaches out, especially with messaging for minority populations and important flu facts like this 82% is what you can reduce your risk of getting hospitalized in an intensive care unit if you get a flu vaccine. So, so they've got some important messages and also some nice Q&A there that you can share. So that is it for me. I will send it back to Kristen, and thanks for everything that you all are doing. And please, if you haven't yet gotten your flu shot, go do that today. Thanks.
Thank you so much, Dr. Fiscus. I really appreciate you kind of dialing into what might be the cause of the decrease in flu vaccinations this year, especially. I think one of the things I've been thinking about as well and educating my TikTok followers is to find free flu shots, because depending on the type of flu shot you have, and if you are uninsured or underinsured, you could spend anywhere from $25 to $110. But there is help. I know that stores like Tom Thumb and Walgreens and CVS and those big box pharmacies do offer them for free. In a lot of places, there are public health interventions like mobile vaccination clinics in Colorado, for instance. So please, please dive into what your public health departments have for you in that regard. And now I will pass it over to Dr. Jossie McCloud, who is the head of Health and Wellness Ministry at the Open Arms Community Church.
Good morning and good afternoon, everyone. Thank you so much for allowing me to speak today. I am in a unique position in that I am the head of our health ministry. However, I just happen to be a medical doctor as well. So I can give a little bit of both perspectives. So what I want to discuss is how the church can promote health and health equity, including support for the congregation and community members, and specifically with regards to diabetes and vaccination. So in general, we may know that, or you may know that the Black community typically listens to their pastors. So the church has been a place where information can be disseminated, and the congregants generally trust their pastors. So we want to make sure that the leaders of the church are on board, number one, with health promotions. And my church definitely is. In fact, it's very important to our bishop that the community is educated very well. And one of the ways that we provide education is by, encouraging health fairs. We want to encourage churches in general to have some sort of a health ministry. But then we encourage health fairs. We do other health promotion events. And we also like to make sure that we support events that are already planned. For instance, if there's going to be something for the kids on the campus of the church, you want to make sure that you always include a health component. We had a family and friends day recently and made sure that we had a little mini health fair with that. Because sometimes the health fairs, people can kind of get tired of coming out to those. And unfortunately, a lot of people don't really want to know what's going on. So when they hear health fear, they think, oh, they're going to want to check my blood pressure or my blood sugar. I don't really want to talk about that. So we try to kind of sneak things in. And one of the things that I've also done with our health ministry is to go to the other ministry meetings. So we have a ministry for our seniors that we call the Pace Setters. And I made sure that I kind of came and sat in on one of their meetings or their monthly activities to provide some health information that would be relevant to them. We talked about medication safety at that time. I always am talking about the importance of diet and exercise because of course we know that that is one of the mainstays of treatment for diabetes. So we also went to the children's church and talked about health and diet and exercise on their level so that we make sure that they're understanding even at a young age the importance of taking care of their bodies, preventing diabetes. Also, you know, if you're having another community event, like I said, you go ahead and add those events. We've done blood drives. We invite the blood bus. And one of the things that does is it ensures that there's going to be a little bit more participation, because I know from experience that if I try to arrange a blood drive and ask people to come out just for that, we're going to get low turnout. So instead, if I know we're going to be having a yard sale, or we're going to be having any kind of ministry awareness fair, that people are going to be there. And then I try to tackle the task of trying to encourage people to go ahead and give blood as well. And that brings me to another point. Of course, we have the fear of vaccinations. We have those who just are not wanting to get them, especially the flu shot. We definitely saw some issues with the COVID-19 vaccine. But even now, when I ask patients or family members, you know, have you had a COVID vaccine? I'll get a lot of them saying yes, because there was that fear for COVID-19 and the pandemic. Meanwhile, I still get the typical answer when I ask, okay, have you had your influenza shot? And, oh, no, I never get that. Every time I get the flu shot, I get the flu or I get sick. So continuing to educate church members just in general about vaccines, and not only focusing on the COVID-19 and the flu vaccines, just to give a general awareness and education on the fact that we have many vaccines that are necessary, especially for those patients who are diabetic, and just kind of making it a conversation that's become the norm. So we talk about how, you know, we've alleviated lots of diseases by vaccinating, and we try to make sure that we make it relative to that person, so something that they can relate to. So we kind of bring it home and give them more personal examples, make it relatable to them. So we talk about family members who may have been ill, or protecting elderly family members at home, or younger children by vaccinating yourself. Again, when we do have our events, we try to provide basic screenings as often as possible, so that the members of the church get used to it. So they know that they're going to be able to get their blood pressure checked. As often as we can, we go ahead and provide blood sugar screenings. That one is a little bit more difficult to do. Nobody wants their fingers poked. But we also reach out to community partners such as pharmacies and the health department, and have them come and provide educational information. We recently had WIC come and provide nutrition information, and that worked out very well. The other thing you want to do is reach out to other health professionals that may be in your church to assist with educating your congregants. Often we have other physicians, we have nurses, nurse practitioners, we even have nursing and medical assistant students who would be more than happy to, be able to get some practice in as far as providing health information and education, but also as far as doing procedures. So we have them come and do the blood pressures and the blood sugar screenings. And we also educate whenever possible. So every month there's tons of health awareness items. Of course, we know November is diabetes awareness, but there's many other awareness month, health promotions that are going on right now in November. So, educate the congregation as often as possible by providing flyers, making announcements, maybe having some small activities during those months. We've done health challenges, The Biggest Loser. We've done steps challenges. So always, be ready to choose one or two activities or events or health awareness topics to present during that month. And it doesn't have to be something that's done every day, maybe once a week or twice a month, just to kind of keep in their minds that, there's something going on and there's always something to learn about. We try to do our blood drives during Sickle Cell Awareness Month. We try to do our blood sugars and things like that during diabetes awareness. We even talk about World AIDS Day and making sure that people understand the importance of getting HIV screenings. So just in general, we want to normalize health education as well as vaccine discussion. So we want to do that as often as possible. And we have seen personally that people can definitely change their minds. We don't want to browbeat anyone. We provide the education, we provide written materials, and we just keep at it. We talk to congregants who are completely against it, but again, once you make it relatable to them and make it relevant to their own personal lives, then I think that you have a better chance of getting that education across and convincing them of why they need to do what we're requesting and recommending that they do. I know when we did do our Sickle Cell Awareness Month and we talked about having blood drives, of course, blood drives are one of the things that are very hard to, that's very hard to get people to participate in. But what we did was we tried to make everyone understand how the bulk of the community that needs to receive the blood is going to be the African-American community, especially due to sickle cell. I think that most people didn't quite understand how often those patients need to receive blood. Also, relating it to cancer and honestly, even someone who may have diabetes or other diseases, you can have anemia of chronic disease. So just trying to bring it down to a level where they can understand it a little better and realize that we all do know someone in our families, or we may personally need to receive blood. So then that'll help them to change their minds a little bit. And the same thing with diabetes and vaccinations. So I am open to any questions anyone may have regarding different ways to try to help promote health literacy and education in the church. And I thank you so much for allowing me this time.
Thank you so much, Dr. McCloud. I really appreciate you really getting at the heart of meeting people where they are, especially those living with diabetes, and not, being accusatory or browbeating people, especially in historically excluded communities like the Black community. So thank you so much. And now for our last, but not least, panelist, Ms. Sarah Mart, who is the Director of Operations at DiabetesSisters. She will give us her perspective from a patient advocacy perspective.
Thank you. Thank you so much, Kristen, and to everyone for being here with us today. Staying healthy with diabetes is a big deal, an important topic for me, both personally and professionally. And I'm here with you today as a woman living with diabetes, a person with many loved ones who live with diabetes, and someone whose professional work is also to help people with diabetes be healthy. These last 2.5 years with COVID have made the professional especially personal for me too, as I have seen loved ones be infected, experience a wide range of symptoms, and some die from COVID as well. And similarly with flu, pneumonia, or shingles, various concerns that we have vaccinations for. We know that having diabetes increases our risk of heart disease, the most common diabetes complication. People with diabetes have worse outcomes after heart attacks, are at higher risk of other diabetes-related complications, such as blindness, kidney disease, depression, than people who are not living with diabetes. And then we bring in the information that we've learned and what we have as far as COVID and these other infections. So we're more likely to be hospitalized, more likely to have more severe or worse symptoms, and have worse complications if we get COVID. And the older someone is, and the more health conditions that someone has, for example, diabetes plus heart disease, and many others, increases our risk of experiencing complications from COVID. So diabetes is an important risk factor for severe COVID experience. And so much of that has to do with hyperglycemia, as Dr. Gonzalvo was speaking earlier. High blood sugar, that thing that people with diabetes are constantly trying to influence and manage and change. Complications from diabetes are prompted or escalated with COVID, flu, or pneumonia. We're more likely to get sicker, stay in the hospital, and even to die. So the risks are more and they're more serious. And we're thinking about it. We're thinking about it all the time. It's not always that we're not aware, although we'll talk more about that in a minute. But the last 2.5 years with COVID have also shifted personal concerns into the professional realm for me. I work for DiabetesSisters, a national diabetes nonprofit, 501c3. At DiabetesSisters, I work with more than 60 volunteers around the country to create programs and content that make lives of women with diabetes easier and better. And we want to make sure that women with diabetes understand our risks and know how we can stay as healthy as possible. That's been amped up and increased even more and become even more important, of course, as we've experienced COVID and flu, pneumonia, etc. And diabetes is not only different for women, it's different among women. Women who are African American, Hispanic, Latina, American Indian, Alaska Native, and Asian Pacific Islander are 2 to 4 times more likely to have diabetes than white women. So DiabetesSisters is always working to ensure that we reach and include women of color too. We know people with all types of diabetes and pre-diabetes, especially women and women of color, aren't always offered appropriate, accurate diabetes education and support that they need. And we also aren't offered appropriate, accurate info and support regarding other health concerns, like these conditions that we're talking about today and their relation to diabetes. So the barriers that we see to people with diabetes getting vaccinated are not new necessarily. They're ones we've seen with other conditions, other issues, and diabetes over time. And they persist, and they can even start to get worse as leaders and funders might feel like the problem is over. The barriers include lack of understandable, empowering messages about vaccination, limited local supply of vaccines, having to go to a healthcare provider's office, a specific office or multiple offices to get vaccinated, to get various vaccines, limited times that they're available, limited locations, having to pay out of pocket for vaccines for each one specifically as well. Losing money, time, work time in order to take the time to get vaccinated. and confusion about vaccine eligibility and healthcare eligibility for the vaccinations. But luckily, the barriers point to exactly what we need and exactly what women with diabetes across the country tell Diabetes Sisters what they need in order to get vaccinated and try to reduce our risk. For women who see healthcare providers for diabetes or heart disease or anything else, those 7 minutes that we get to see our healthcare providers need to include a question and interaction about whether or not we've gotten vaccinated, boosted for COVID, flu, pneumonia, shingles. I add them on because they're out there, and we know that we possibly can get vaccinated for those. If our answer to you, the healthcare provider, is not yet, the vaccines need to be available and encouraged right then, and hopefully for free, as Kristen said earlier. For those of us who don't get to see healthcare providers regularly or ever, we need it to be super easy to get the vaccinations we need. We know that community health workers are key. Getting accurate, empowering info to beauty salons and barbershops is key. And even more, having access to the vaccines right there. Churches and health ministries in churches are key, again, as we just heard. Again, for both amplifying accurate information about vaccines and having affirming messages from trusted sources, people that we trust, and hearing those messages again and again. As has been said also, it's important. Connecting vaccination and our own health and the health and well-being of our communities and loved ones is key. It needs to be easy to get vaccinated. And because the distribution of COVID-19 vaccines is organized on a state-by-state basis, it's important that this be local, and for people to know about what's going on and how they can find, how they can come in contact with vaccination info and the vaccines themselves locally. And at Diabetes Sisters, we know that peer support is incredibly important, that education and encouragement is an important piece of the puzzle as well. One of our signature programs, the part of Diabetes Sisters or PODS meetup program, coordinates peer support groups in more than 30 locations around the US and online. And volunteer peer support leaders who are women with diabetes or pre-diabetes are provided with topics and discussion modules for each month. This year, the September module was Being Prepared, which includes emergency preparedness, sick day preparedness for women with diabetes, and recommended vaccines. And we talk about our increased risk for severe illness, hospitalization, and continued chronic problems from viruses such as COVID, flu, pneumonia, related comorbidities such as heart disease, the symptoms we need to watch for, the questions we need to bring to our healthcare providers if we have appointments coming up, and ways we can take action to lower our risks. So vaccination is high and top of the list for that. At Diabetes Sisters, we work hard to empower all women with any type of diabetes or pre-diabetes, and to know both the facts about our conditions, that's plural, and ways to live our healthiest lives. And as I share all of that about our program, what we've done, and listen to our esteemed panelists talking about the risks and where we are as a country, what keeps coming to mind for me is how many people with diabetes have been vaccinated and or boosted for COVID, flu, pneumonia. Do we know? And how do we know? And let's keep after it. So thank you.
That was absolutely beautiful, Sarah. Thank you so much. I want to really now move to our Q&A portion. So I'll ask Sarah and Dr. Gonzalvo to help us move through these questions. We have some pre-submitted questions, and then I think a couple in the Q&A box that are live. So the first pre-submitted question we have is, what is the role of NMQF/SHC on the people already affected by diabetes? So if you didn't know, SHC stands for the Center for Sustainable Healthcare Quality and Equity. That is our team, and that's where this entire sort of Champions for Total Health webinar series came from. So we have a number of type 2 diabetes quality improvement programs going on around the country. We have one in Oakland, Chicago, we are expanding our previous work in New Orleans, Louisiana, and in Queens, New York. In each of those, we are working with FQHCs and safety net hospitals to really improve health outcomes for individuals already living with type 2 diabetes, and in some instances on the prevention arm, so those who may be have just been recently diagnosed with pre-diabetes as well. I won't go into detail because we don't have much time, and I know we have a bunch of questions to get through. But we also have some educational information. So I'm going to ask my colleague, Leslie Orchini, to drop in our microsite in the chat for you guys to go to that talks specifically about diabetes and the intersection of vaccinations. So our second pre-submitted question, what is your recommendation for having promotoras, so community health workers, discuss both vaccines and diabetes prevention within a particular community? So this commenter really has already been doing this work with promotoras with COVID-19, and I'm assuming they want to expand that to flu. So any suggestions there from the panelists?
I think it's a fantastic idea. It's great. Yes, please do. Yes, support.
Awesome. Any tactical suggestions, like do they need certain materials or education, or do they need certain support from people like NMQF? I don't know.
With the work that I do with CHWs, I think that, you know, any area that, you know, you'd really like to work with CHWs and focuses just need a little bit of education and the right resources, and go and they work their magic. So I think, you know, no need to recreate the wheel. I think there are a lot of resources out there just that are fairly kind of appropriate for different audiences in languages and across a variety of different, you know, here's why you should get whatever vaccination. So I think it would be pretty easy for a CHW or a promotora to find those reputable resources. But I also think just, you know, working with the employer to say, here's what I need, here's what I want to do, here's the need in the community. I think it's a fantastic idea and is not too heavy of a lift because a lot of the resources already exist.
Yeah, that's exactly what I was thinking. So thank you. Okay, so our next question, what is the difference between the monovalent and bivalent vaccines for COVID?
I think I was supposed to take that too. Anyone else, please join in. I just think that we had sort of assigned this to me. Essentially, the monovalent contains the original strain, the mRNA strain of COVID that, you know, caused the whole pandemic in the first place. And then when we saw the Omicron variant come out, we knew that that strain was also very prevalent in addition to the original strain. So monovalent is just the original strain. Bivalent has mRNA coverage from the original strain and the Omicron variant. So basically just trying to cover both variants with the bivalent vaccine versus just the monovalent.
Absolutely. And it kind of, if you think about the quadrivalent flu vaccine that has different flu variants in it as well, this is kind of the same functionality, if you will. And hopefully we won't have to get to a quadrivalent, but I don't know. It seems like COVID-19 is like, I'm just going to keep producing more babies and they're going to be fit to withstand all of the shenanigans in society. So anyway, the next question, if I have received the monovalent, how long do I have to wait before I can get the bivalent? I'll go ahead and take this one, Jasmine. Just really quickly, if you have received the monovalent recently, CDC guidance is 3 months. It's not going to be exact It's not going to be, it's 6 months after the monovalent, 3 months if you've had COVID-19, It's not going to be exact to the day. It's really more of guidance so that your immune system can have the most robust response to the bivalent vaccine. Okie dokie. As a person with diabetes, should I also get a pneumonia vaccine?
Yes.
That was easy.
and again, it's just really because again, being at risk for sort of more serious complications from these types of illnesses, and getting vaccinated to get prevented or lessen the severity, I think is warranted.
All righty, and our next question, how safe is it to receive all these vaccines simultaneously? Flu, COVID, pneumonia. Can I get them all in the same arm? So co-administration.
Yes, you can get them all at the same time, all in the same arm. You can kind of share your arm space, arm real estate, though, if you want to. There's some minor administration things like I believe it's like 1 inch away from each other if it's intramuscular, for example. But yes, you can get a lot at the same time in the same arm if you wanted to, just sort of spread out on the same arm if you were going to.
Awesome. So I'm going to go to the live questions. Given the risk of diabetes onset to folks infected with COVID, is it reasonable to recommend folks discuss pre-diabetes lifestyle prevention and monitoring strategies with their providers, and proactively recommend these approaches to folks previously identified with pre-diabetes, gestational diabetes, or high risks, especially if in the context of SDOH? And are there data yet to see if there's greater likelihood of diabetes onset in anyone with those risks? That was kind of a quadruple-barreled question. So first, is it reasonable to discuss pre-diabetes lifestyle prevention and monitoring strategies?
This is just an opinion, an educated opinion, but yes. Pre-diabetes lifestyle interventions are actually pretty generalizable to the general public of really healthy food selections, everything in moderation type deal. So probably I'd be hard pressed to find a situation where pre-diabetes lifestyle counseling wouldn't be appropriate for most people. I think what the question is really alluding to is really, people with prediabetes or at risk for diabetes should know that getting COVID could potentially push you in the wrong direction towards diabetes or developing diabetes. And so I think that the general awareness, I think, of the relationship is important, so that people aren't surprised. I don't know that, necessarily people would maybe do much different, but I think improving the awareness of the relationship, the bidirectional relationship, is important.
Perfect. And then the last live question that we have, when children die from influenza, do they usually have some other health issues that make them more susceptible to serious illness? That may be a question for Dr. Fiscus. She had to step off. I will send that to her and we will get an answer. And then we have 2 more minutes. So before we hop off, I did want to ask one of our last pre-submitted questions, which is, what can we do as public health practitioners, as clinicians, and what are our action items moving forward, and how do we leave a bigger footprint? I guess in the way of that submitter was asking, in the way of getting more people living with diabetes vaccinated.
Well, I think to begin, but we've been talking about it this whole time, start where you are and ask the question in terms of vaccination efforts and what's going on right now. And ask the question for any individual on the individual level that lives with diabetes, if they've been vaccinated, for these various, gotten them all, and support the efforts that are in the community right now.
That is a great answer. Thank you, Sarah. We did have one more question in the Q&A, or two more questions in the Q&A. It really is about, should there be a formal regular recommendation? Should providers have a plan to respond to COVID diagnoses by emphasizing prevention interventions for anyone at risk? Yes, I will say yes. I'll turn it over to Dr. Gonzalvo and Sarah.
Yeah, I don't think that there's any harm in that. And if there's capacity to do so, I think there's definitely room for benefit in that space.
And with the work that we do with Drive Flu and Drive COVID-19, we do help provide that capacity in that space for clinicians and their health systems to really have regular recommendations around these types of intersections. So I believe that is it. We are at time. I really want to be respectful of everyone's time, and I would like to thank all of you for joining us, especially our panelists, Dr. Gonzalvo, Dr. Fiscus, Sarah, Dr. McCloud. Thank you so much, and look out for that YouTube recording to be posted on our page. Have a good holiday, everyone.
Great. Thank you.